Hello, I'm Maurilio Garcia-Gil, a urologist here at Urology San Antonio, and I was going to talk to you a little bit today about kidney stone surgery. I'm an endourologist, meaning I did a fellowship training in endourology, which is a approach to minimally invasive surgery within the urinary tract. Typically, this means we use tiny cameras within the urinary tract, either entering through natural openings or tiny incisions in order to treat different problems. The most common of those that we treat are things like kidney stones. Kidney stones are actually very common. About 10% of people will get them in their lifetime. And they're actually small deposits of minerals, most commonly involving calcium, that can obstruct or block the urinary tract. This can cause pain, this can cause bleeding, this can cause damage to the kidneys over time, and it can cause infections that are difficult to treat. When it comes to treating kidney stones, there's three main surgeries that we do. One of these is external shockwave lithotripsy. What that means is you're asleep, and then a series of energy waves are passed through your skin into the stone, breaking it up into small fragments, making it easier for you to pass those fragments yourself. This works well for smaller stones that are a bit simpler. There's another type of surgery called ureteroscopy, where a small camera is passed through the urethra, the hole where you pee from, through the bladder and up the ureter, the tube going from the bladder to the kidney, up to the kidney, where the stones can be seen directly and broken up, most typically with a laser, and then those pieces are removed. The good thing about that is we can remove pieces of stone so that there's less that you need to pass, and we can get samples for analysis, though this is slightly more invasive. This works well for a broader variety of stones that can be a little bit larger and more difficult to reach locations. The last type of surgery is percutaneous nephrolithotomy, or PCNL. This means that a small incision is made in the skin over the back, going directly into the kidney, and we can pass a tube with a camera through it inside the kidney and directly treat stones that are larger, more complicated, in more difficult to reach locations, and that are often with previous infections. While somewhat more invasive, this allows us to treat stones that would otherwise not be treatable. Classically, normally, this is done with the patient on their face during the surgery using larger sheaths. In my practice, I tend to do this with the patients laying on their back, so that the anesthesiologist has better control of their airway, and so that we can have secondary access to the urethra, and we can even do a ureteroscopy at the same time. What this means is that I can use smaller sheaths to go into the kidney and treat these stones. This allows for less pain, faster recovery, and less need for drainage later on. However, many of the stones that I treat in my practice are very large and very complicated, so this approach can be applied to a wide variety of stones. So while kidney stones are very common, my practice focuses on kidney stones that are larger and more complicated. And due to more recent advances in technology and techniques, we're able to use lasers that allow for faster fragmenting of stones, and positions and techniques and devices that allow for smaller incisions, faster recovery, and less need for drains afterwards. Sometimes we can even send people home the same day for some of these large, complex stones. So here at Urology San Antonio, we've been trying to expand what can be done for these complex stones.